When polarity is disrupted, signaling becomes inefficient. And this does not mean that something is like inherently wrong with the individual. It means the system has simply lost coherence. Polarity issues are associated with chronic stress or trauma, prolonged inflammation, which anyone with chronic pain is likely going to have experienced. They could have a neurological overload or long-term EMF exposure, so you're seeing that connection between the two. Even a recent surgery or illness or an injury that they received could increase those chances of a polarity problem. Many clients come into practices doing all the right things, right? They come to see you. They say they're doing everything right. They're eating well. They're hydrating. They're resting. They're using supportive therapies. But their progress is inconsistent or it stalls completely. In these cases, two often overlooked contributors are EMF sensitivity and electrical polarity imbalance. This is sometimes referred to as reverse polarity, which is what we'll be talking about today. This training is going to be about learning how to recognize patterns and indicators that suggest that these factors may be influencing a client's healing response. And in turn, you can then adjust your approach, not push harder. This is not about diagnosing. It's about pattern recognition and clinical awareness, okay? So first off, let's try and understand EMF sensitivity. And we'll start with that. And let's do it in the simplest way we can. EMF sensitivity refers to a state in your body in which it has difficulty tolerating or adapting to exposure to electromagnetic fields, okay? Common sources of this would be Wi-Fi and Bluetooth, cell phones and tablets, smart meters, which are on most homes now, power lines, even wearable tech like smartwatches, Fitbits, and so on. Now, everyone is exposed to EMFs, but not everyone feels it or responds in the same way. If someone is EMF sensitive, they may notice an increased overstimulation of the nervous system. Sleep disruption can impact them too, right? They're waking up a bunch or they're not getting proper sleep. Headaches can occur throughout the day. They may have unexplained inflammation. If they don't have necessarily a diagnosis of an autoimmune disease, but they have full body inflammation, well, that is a good indicator as well. And they can even show impaired cellular communication, so that their tissues aren't communicating the way that they should. Now, the important thing is that EMF sensitivity is often kind of contextual. It worsens when the nervous system is already stressed or depleted. So in many cases, someone that may be EMF sensitive could survive in a general vicinity to these EMFs. But when something is hitting their nervous system harder, then that stuff will just tank them. Now, there are some common patterns suggesting EMF sensitivity. And I think for us as practitioners, when we're using electrical technology, when we're using PEMFs and scalar, it's something we want to be able to sit down with our clients and have them immediately know, right? Oh yeah, I'm EMF sensitive. Okay, now I can adapt. I can do, my elimination assistance protocol, or I can start with scalar, or I can do this, that, or the other things that we do to counteract that. But instead, you're often going to have to read between the lines because most people aren't even going to be aware what this is. They may report patterns like symptoms worsen at night or in bed. They may say headaches or agitation occur after they use their screens. Maybe they work in an office and every day at the end of the day, they have these blinding headaches. Difficulty sleeping despite being exhausted. They might even say that they've got increased pain or anxiety when they are in the city, right? If they're downtown, and maybe they've attributed that to it's so busy, but it could be the EMFs from all of the Wi-Fi. They could say that they feel better when they're outdoors or away from technology. And they might even notice that symptom flares, so things that make them worse, don't match diet or stress changes. Maybe they're thinking it must be something I ate, but I've eaten that for so long and never had a reaction before. This suggests that there is something else going on, and EMF sensitivity could be that too. Now, one of the things that as practitioners we may see is that they get temporary improvement with treatment, but they don't hold the gains they make. This suggests that the environment could be undoing the work unwittingly. So that's EMF sensitivity. What about reverse polarity? Now, reverse polarity is something I've touched upon, but I've really not dove deep into. So hopefully this will help bridge that gap for you aspiring or existing practitioners, because this refers to a disruption in the body's electrical orientation. So what does that mean? Cells, as we know, rely on electrical charge and directionality, right? Polarity helps tissues communicate and regenerate. So if polarity is right, we're able to do these things properly. Now, when polarity is disrupted, signaling becomes inefficient. And this does not mean that something is like inherently wrong with the individual. It means the system has simply lost coherence. So someone is not permanently stuck in a situation of reverse polarity, right? Polarity issues are associated with chronic stress or trauma, prolonged inflammation, which anyone with chronic pain is likely going to have experienced. They could have a neurological overload or long-term EMF exposure. So you're seeing that connection between the two. Even a recent surgery or illness or an injury that they received could increase those chances of a polarity problem. Now, how do you observe this in patients? Because again, they're probably not going to come to you and say, hey, doc, I got reverse polarity, right? That's not something that you're necessarily going to see. I think it's all about patterns, right? And as a holistic practitioner, you can't diagnose anyway, so we don't want to be chasing diagnoses, but we need to know what's going on so that we can make the most informed decisions for our clients. Possible indicators of this, what would they include? Treatments just feel off, like maybe they don't feel right from the treatments, or they feel inconsistent, right? Like sometimes it works really well, and then the next time it just doesn't do anything for them. If a client, through all of their experiences, not just microcurrent, but other things too, they often feel a lot worse before they feel better. So they make a dietary change, and it makes them feel really, really bad, even if it was a small change. And this is what happens time and time again. Sensitivity to therapies that are usually gentle. This can be challenging because, of course, we see the same thing with EMF sensitivity and microcurrent, right? But if they have a sensitivity to, say, massage, like someone starts to do a gentle massage and it's uncomfortable for them or it hurts them, some of these physical therapies can be great indicators. Maybe they get a chiropractic adjustment, just a little adjustment, and it makes them have a detox reaction. These can be signs of reverse polarity as well. They could have alternating responses from session to session, right? One session they feel great from the treatment, the next session they feel horrible from it, right? And it's very challenging to get that consistency. They might have difficulty feeling settled down, so they may always be like going, go, 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 right? And of course, exhausted at the same time. So they could also just have complete paradoxical reactions to supportive interventions. I don't see it very often, but it's like if someone has a negative reaction to scalar energy, and you're like, okay, so you had a negative reaction to the most gentle healing energy that there is in the world that's so subtle that it, is imperceptible and is as weak as the energies of the earth, yet it threw you into a detox spiral. Okay, this is a good indicator that something's going on. That to me is a bit of a paradox, right? If something is inherently pure and healthy and it makes someone thrown off completely, that's a problem. Another one I've seen before is clients that can't drink water. They find that even well filtered, good quality water makes them sick. I mean, our body needs water to live, right? But if they are like, I can't drink water, this is a sign to me as well that there could be a polarity imbalance. Now, you may notice this repeatedly, and this is something that's not going to come up often, but when it does, you're going to have to look for the patterns, because you're going to probably look at it and say, well, this should help, but something isn't working here. And this is where you have to think, aha, could it be the polarity? This is the cue to look into the coherence issue rather than adding more input. Now, You can observe this in practice easily, right? You can pay attention to these things, but it does require that. It requires paying attention. Looking at symptom timing, right? Day versus night. Responses to technology breaks. If they're able to leave their phone at home or they're not allowed to access it when they're at work and they feel great at work, but then they go home and they feel bad, that is a sign too. Changes when EMF exposure is reduced. So again, if you're going for a walk in the woods, you're going on a hike and you feel great when you're doing it, but then you go home and you feel crummy again, this is a sign too, right? And if you're ending up with this ability to hold treatment gains over time, you can sort of say that people are actually, if they are doing it, they are making strides to correct it. And if they're struggling to do that, then there is an issue there. All you're doing here is collecting data to their responses, and that can guide you properly because the body's response is always going to be the clearest indicator, right? So that's what we need to look for. Now, if you suspect EMF sensitivity or polarity issues, it's not going to be the answer to push harder, right? Instead, you want to simplify your protocols. You want to reduce the environmental stressors, those that are already there in people's environments, and prioritize nervous system regulation. You need to support grounding and coherence, and you need to allow more recovery time between interventions, pushing into simple protocols like you take your vagus nerve from the 3 minutes down to 1, right? Like, make it simple, make it gentle, make it slow. And in the cases of polarity issues, you are probably going to need scalar energy to correct that. But these gentle, consistency-based approaches, these will work better in most cases than aggressive ones. And importantly, if symptoms are severe or they are concerning, you should try and look for some extra support to figure it out because there's like this think tank conversation going on, right? And this is one of the great things about the communities that we're in here on Facebook, is that we're able to actually talk with each other and see what things might be. And different specializations will have different approaches to these things, but sometimes you need to branch out and look into these different options. Now, how do we finish this on up? Okay, because this is a big topic for me, and I think I could just keep going on it, but I suppose the point is when EMF sensitivity or when polarity imbalance is present, pushing harder backfires. And we need to be able to identify this, to recognize these patterns in order to prevent this backfiring on us, right? So recognize these patterns. This will allow you to adjust your expectations, to know that it's not you, right? To know that this is something that might happen, to refine your approach, to inform your clients, like let them know, reduce their frustration, reduce the chance of them being like, I'm going to go to a different therapist or I'm going to try something different. This isn't for me, when you know it can help them. And ultimately, it'll improve their long-term outcomes. It's not about labeling people, it never is, but it is about figuring out what the underlying issue is. It's about listening to the system of the body and creating an environment where healing can actually hold. So I think that's it for this week, everyone. So thank you for joining me for this training. Hopefully this will help some of you identify if some of your clients have EMF sensitivity or if they have reverse polarity. That is the intention here, right? Let's learn. Let's figure this out. So until next time, guys, I'll see you next week for another 10-minute training. Take care. Have a wonderful weekend.